Now, live from Whitney Media, 1460 WVOX, the Greenberg Report with Greenberg Town Supervisor Paul Feiner. You can join in the conversation at 914-636-0110. Now on 1460 WVOX, here's Greenberg Town Supervisor Paul Feiner.
Good morning. My name is Paul Feiner. I'm the Greenberg Town Supervisor. And today we're going to be talking about a very interesting topic with Dr. Adam Weissman. Dr. Adam Weissman is the founder and president of the Child and Family Institute, a mission-based behavioral health organization, and the Weissman Children's Foundation, which is a nonprofit in development with a joint mission to increase access to best practices for underserved children, families, and communities throughout the United States. Dr. Weissman is incoming president of the New York State Psychological Association, and he's on the board of directors of many mental health nonprofits. Dr. Weissman is also an author. He's won many service and research awards, and he also received the 2020 Distinguished Contributions Award from the American Psychological Association and the Board of Professional Affairs. And he was named 40 under 40 Rising Stars in Westchester County. So, Dr. Weissman, thank you so much for joining us.
My pleasure, Paul. Thank you so much for having me. I really appreciate it.
Could you maybe start by just telling us a little bit about what the Weissman Children's Foundation and the Child and Family Institute, what they focus on?
Sure, yeah. I'll give you a little preface as far as why we started the Weissman Children's Foundation. There's really, and obviously in the media right now with COVID, with the pandemic, a lot of people are talking about the public health crisis, the economic crisis, and I think the forgotten crisis is the mental health crisis. And I know people are starting to talk more about it, but really there's not enough being done systemically to help all the people who are struggling with the psychological sequelae of everything that's going on right now. And even before COVID, this was a major issue in our country. So what has been going on for a long time is that to access gold standard science-based treatments, mental and behavioral health treatments, which are basically treatments that are designed based on cognitive and behavioral science, and are tested, in research groups and laboratories and randomized control trials, and have been shown to be efficacious, have been shown to work really well for things like anxiety, depression, ADHD, behavioral issues, habits, eating disorders, all those types of issues that we see in children and families and adults. Have trouble making their way into the public sector, into common practice, routine clinical practice in the real world, because they're really hard to access, especially for families who don't have means. And so what we'll see is that to get access to these gold standard, state-of-the-science mental and behavioral health treatments, you really do have to go to a private practice and pay at least $300 or $400 an hour to be able to receive those specialized services. And unfortunately, the national healthcare system has not adequately prioritized coverage for evidence-based services in the mental and behavioral health arena specifically, and insurance reimbursement from the insurance companies for most of these specialized out-of-network treatments is fairly limited. So the result has been, and this is before COVID, it's going on for a long time, but now, of course, it's exacerbated by the pandemic. The result has been an overwhelming majority of the U.S. population, both uninsured and underinsured children and families nationwide, left without access to affordable, gold standard mental and behavioral health care. And in addition, there's really a significant lack of evidence-based service providers and training programs nationally, particularly in more remote communities. So based on all this kind of mounting public mental health crisis, especially in the current situation, we started Child and Family Institute back in 2011, And now we started the Weissman Children's Foundation, which is a not-for-profit, so pro bono services, really to help revolutionize the mental and behavioral health landscape in our country, because it's not being done from a federal or systematic level. So we've decided to try to tackle it privately.
So we have to take a break, and then we'll be right back.
Okay.
You have to break with Dr. Weissman, and we'll talk about Weissman Children's Foundation and some of the issues relating to COVID and children. I'm Paul Feiner.
Great.
We'll be back in 5 minutes.
WVOX. Now back to the Greenberg Report on 1460 WVOX. Once again, here's Greenberg Town Supervisor Paul Feiner.
Hi, this is Paul Feiner. I'm the Greenberg Supervisor, and my guest is Dr. Adam Weissman, and he's the president and founder of the Child and Family Institute and the Weissman Children's Foundation. Dr. Weissman, if any of our listeners can't afford, the care, what do they do?
Right. So that's the point of the Weissman Children's Foundation. It's really to be able to offer these kind of gold standard, state of the science, evidence-based mental and behavioral health care treatments that are not accessible to most people, to every child and family in need, regardless of the ability to pay. So, that definitely folks should feel free to reach out to us. This is a new venture. I think it's the only nonprofit foundation like this that exists on a large scale, and we're in development, we're in early stages, but we've actually already helped about 40 families in the Westchester and New York metro area through our Corona Relief Initiative. So people should definitely feel free to reach out to us. They can. And
what's the contact number?
Yeah, they can go to our website, which is weissmanchildrensfoundation.org, or they can also they can email. I can give you two email addresses. They can email me. The easiest email for me, I have a bunch of different ones, but dradamweissman@gmail.com is the easiest one to say over the radio. So that's Dr. No period, just DradamWeissman, all one word. So dradamweissman@gmail.com, and then also they can contact our main line, which is our main email, which is info@childfamilyinstitute.com. Those would be the easiest ways.
This is a really amazing service. Do the doctors who are involved in this, are they all donating their time, or is this something where people make donations and then your foundation pays the doctors for the services?
Yeah, so it's really a combination right now in the grassroots stages. So we have several doctors who are donating their time completely pro bono, and then we have a number of clinicians who I'm personally funding a lot of this just as we start. So I'm making sure that they're compensated for the work they're doing. And then we also have some initial funding sources coming in, but we're in development, so we are not a 501c3 yet. We will get that status hopefully in the next year or so, and then we'll be able to start really doing more fundraising efforts to scale this programming and be able to compensate and bring in more clinicians so that we can help a lot more families than we already are.
It's really amazing. I know with lawyers are expected to spend some time doing pro bono work. Is it the same thing with psychologists?
It's actually not. I'd say that most folks don't really do this. I think that some do, but I think that especially with folks who are trying to start their own practices and things like that, I think people are, especially in this day and age, are really concerned about just being able to stay competitive and make a living and take care of their families and build their own practice. So, yeah, I think that the majority of folks in our field do not do pro bono work, but some certainly do. I think we're lucky to have the people around us that we do. We have a great team.
Could you maybe tell us what some of the COVID-related issues are among children?
Sure. Yeah, this COVID. So, the COVID Relief Initiative is the main project that we're working on right now as we start this foundation. There's a lot of mental health sequelae of this pandemic that I think a lot of it's really going under the radar to some extent. Whether it's children and adults and parents, think about the social isolation that people are experiencing from social distancing and stay-at-home orders. Obviously, that's going to have an impact on a lot of people as far as just lack of socialization, a lack of exercise and sunlight, definitely contributing to higher rates probably of depression, anxiety. A lot of people are also, kids included, are sheltering in place with potentially unhealthy or even abusive relationships. Whether it's domestic violence or whether it's actually, it could be child abuse, could be anything we don't really know about, right? So there's definitely going to be higher rates of trauma, and of course people are dying, so grief. A lot of these different issues, including OCD. We're probably seeing OCD on the rise because of the fact that we have to be so careful with contamination-related issues. So there's a lot of different potential challenges with kids and with families in general, including parenting challenges arising from parents being super stressed out about having to, navigate and balance homeschooling their kids and working from home. And sometimes both parents are working from home and they have multiple children and no help, especially these days with, even if someone could afford help, a lot of times the au pair or the nanny are back in their home countries and not actually able to stay with the families. So for the folks who do have means even. So there's a lot of potential mental health issues and just family challenges that are cropping up more than ever during the pandemic. And I don't think people are really, that we're as a culture aware of that enough, and that the families necessarily know how to seek appropriate help during this time.
And I guess during the summer, it's also more stressful for people because everybody would like to be at camp or at the pool, and right now both are closed.
Yeah, I think it's going to be tough for parents to try to figure out what to do with their kids this summer. I think almost all, from what I hear, most camps now officially closed. Just a couple that are still holding on, still holding out hope, and are making those decisions in the next week or so. But it seems most likely that most camps will be closed, the sleepaway camps, et cetera. So parents are going to have to get really creative.
Yeah, we have to take another break. This is a little shorter, and we'll be right back with Dr. Adam Weissman, who has an amazing group, the Weissman Children's Foundation, which provides services for people who can't afford psychological services for their kids. I'm Paul Feiner, Greenberg Town Supervisor.
Now, back to the Greenberg Report on 1460 WVOX. Once again, here's Greenberg Town Supervisor Paul Feiner.
Hi, I'm Paul Feiner. I'm the Greenberg Town Supervisor, and my guest is Adam Weissman, and he has started the Weissman Children's Foundation. It's a nonprofit in development with a joint mission to increase access to treatment for underserved children, psychological treatment. Dr. Weissman, I have another question. As right before the break, we were talking about the summer. People are, a lot of kids and families, they would love to go swimming. It's closed. They would love to send their kids to camp. They can't do that. What advice would you give to parents how they could best cope during this crisis?
Yeah, it's a great question, and it's really tough. And there's no perfect answer because no matter what we do or try to do, it's not going to be the same as normal life, and kids are not going to be able to be kids the same way that they normally would if they were able to do those things. However, for everybody's sanity involved, I think it's really important for parents to try to maintain a sense of structure, obviously calm and structure during this time, specifically during the summer when they don't have the structure of homeschool that they had at their disposal during the school year. Now it's going to be even more important for them to be creative and think about ways to structure the day, have activities planned for the kids, and also get them outside, right? So making sure that they're getting exercise, they're getting sunlight, and that they're able to socialize in whatever way would be safe for them to do so. So, if it's FaceTime with their friends, then that's great. If they're able to do safe social distancing bike rides together or things like that with their friends, that's even better. Once we're feeling more confident with that as a safe option. But, just kind of ways to resemble normal life and normal socialization as a kid as much as possible, but also maintaining that structure that they would have if they were in camp or they were in other types of summer programs. So they're not just sitting around all day playing video games and not having that sense of kind of parental structure and things to keep them busy and healthy and engaged.
Right. Sometimes when I'm biking around the community, I see lots of kids hanging out on the bicycle, and many of them are smaller kids. They really are not social distancing, but at the same time, they're having fun. For some parents, the lack of social distancing could be a big concern, and it's hard when you have young kids to convince them that it's not safe to be near their friends. Yeah,
I really think it's tough to enforce from a parental perspective if your kid is going on a bike ride with friends and you're not there with them. I think like everything else these days, it's kind of like a risk reward situation where at some point you want your kids to have somewhat of a normal life. You want them to be social. You set up parameters for them to the best of your ability and hope that they're going to be safe. And sometimes I work with patients directly who the kid tells me that they go on a social distancing bike ride and they have their mask and they stay, a little bit away from the other kids, but the other kids that they're with are not following the same procedures. So it's hard to regulate this in a group setting. But I think parents just have to do a good job of the best they can of really talking to their kids about safety precautions and trying to entrust that into their children, and hopefully their children will follow suit. But it's not going to be a perfect system, just like with adults, right? It's not going to be a perfect system, and does it mean that you shouldn't have your kids do some of those activities with the safety precautions in place as much as you can? I'm not one to say that you shouldn't, but again, it is a risk reward, and it's not going to be a perfect situation, just like with adults. So it's tricky.
Right. So if somebody's a parent and they say their kids are going biking, they put the masks on, they're told about social distancing, but sometimes their friends are going next to them. Would you recommend that they? Parents say you can't go with these friends anymore?
I think it's tough. I think that it also depends on the age of the kid, right? So if at some level, the parents could also, if there is a kid they're hanging out a lot, and and then they know the parents, they can call the parents, they can have a frank discussion about it. And I think that is potentially appropriate in this particular situation.
Right. And I guess one concern that people have is survival, and the other concern is mental health. And if the mental health aspects are not addressed, that could be a big crisis. Also, do you feel that
the balance, right?
Do you feel that since this is going on, so long, and kids are not getting the experience of, being with as many other kids right now or socializing. Do you think there's going to be long-term psychological problems that, children are, who are living through this are going to have later on in life because of this experience?
It's a great question, and I think it probably depends a lot on the individual kid and their developmental stage. I imagine for certain younger children, they might not even remember it very much. And for older kids, the positive there is that they can sometimes do things like social distancing, bike rides, or be more engaged over social media or FaceTime, Zoom calls, things like that with their friends. So if they're old enough to really be affected by this, a lot of times they're the ones who are able to actually engage and keep some semblance of normalcy. And if they're young enough to not be able to really use those platforms, they may not remember the details as well. So I'm hoping, I'm an optimist, so I'm hoping that those protective factors will really help all ages. But no doubt there are kids who are going to remember this and be scarred by this experience and have missed out on important birthdays and sweet 16s and bar mitzvahs and other types of milestone, graduation, obviously, other types of milestones in their lives that would really normally be celebrated by their families and communities, and even that itself is a small trauma. So no doubt people are going to be, kids and parents will be affected by this in the future. And always remember this, but hopefully turn it into more of a silver lining, because there are lots of silver linings that could come out of this as well. So that's the way that I'm hopeful that we'll come out of this. And although there will be mental health challenges to deal with, kids are resilient, and we'll be able to get over this together collectively. But each individual will have a different pathway, mental health-wise, and certainly some kids will struggle more than others.
If somebody had a summer job, planned, and now the summer job or internship was revoked or canceled, what would you recommend that a student do if they're older?
If they're older, like a high school student who had a summer job, and maybe it was a nice source of income, and also something that they can do and build, put on their college application and all that kind of stuff as well.
Right.
I think that's tricky. And, if there are ways potentially, obviously if they need the money, that's one thing, because obviously it's a huge economic crisis right now. And so they would be in the same situation as their parents are potentially with the current economic crisis. So that's challenging. It's difficult to find ways, I think, to make money as a high school student or even college student right now. But as far as the other piece, we have a break?
Yeah, we have to take the last break.
Okay.
I'm Paul Feiner with Dr. Adam Weissman, and he's founder and president of the Child Family Institute and the Weissman Children's Foundation, a not-for-profit organization that provides best practices that develop treatments for underserved children. I'm Paul Feiner, Greenberg Town Supervisor. We'll be right back.
1460 WVOX.
Now back to the Greenberg Report on 1460 WVOX. Once again, here's Greenberg Town Supervisor Paul Feiner.
Hi, this is Paul Feiner, and I'm the town supervisor, and my guest is Dr. Adam Weissman, and he has a foundation, the Weissman Children's Foundation, which is providing services to children, psychological services to children and their families who cannot afford the services. And Dr. Weissman, could you just again give us, a contact information or website that people could could reach you at?
Absolutely, yeah. So they can go to weissmanchildrensfoundation.org. We'll be updating our website soon, but for now we have some information there that'd be helpful. And the best contact would be our main email address, info@childfamilyinstitute.com. or they can also email me directly at dradamweissman@gmail.com or dradamweissman@childfamilyinstitute.com. And that's just Dr. Adam Weissman, DRADAMWEISSMAN, all one word, at Gmail or at childfamilyinstitute.com.
Right. Are you finding a lot of conduct problems among children and their families?
Yeah, that's obviously an issue already, but I think that I'm getting more and more calls. I've offered a lot of pro bono services to my former clients, and now I'm getting more calls out of the woodwork saying, "Oh, we really would like to take you up on that. We're having a really hard time with our 3 kids, especially the 8-year-old." And I think that kids are really getting cooped up at this point. So yeah, I think you are seeing a rise in some of the behavioral manifestations of some of the underlying issues, whether anxiety or ADHD or even kids who are depressed. But you're definitely seeing more of that coming out in a behavioral kind of way, behavioral problem kind of way, with kids being cooped up for so long, and kind of all the family members just around each other constantly, and probably getting on each other's nerves, even in the most easygoing family where everybody gets along really well. Eventually, that's going to become an issue, and obviously, there's lots of families where there is more tension and there's more vulnerable relationships, and a lot's going on behind the scenes, and naturally, it's going to be hard to, for all members of the family involved, but especially for those kids who are faced with challenges, and maybe those parents don't have the tools to help navigate their children's challenges either. So I think an important thing you mentioned about the kids during the summer, things they can do. And I think there's a lot of things that they can do to build structure and purpose and set some concrete goals. But another thing is just that if there is a situation where some mental health support might be helpful, whether it's for the child or for the parents, the summer is not a bad time to actually be thinking about finding some support, especially with wanting to get some more structure into the day, into the week. Having a once a week check-in with somebody, whether it's, cognitive behavioral therapy for a kid who's struggling with anxiety, or working with the parents to teach them some of the best strategies for managing child behavioral issues or other types of related challenges. The summer might be a really good time to actually start getting that support.
I'm just sort of thinking, as the town supervisor of a town with a lot of people who probably have anxiety, depression, conduct problems, is there any recommendations you would have for municipal government so we could actually make life better for the children and parents in our communities, at the same time recognizing that we have to comply with social distancing if we're not opening up the pools, if we're, I don't know if we're going to be able to, if we can't open up the camps, what could I do to make life a little bit more bearable?
I think that's a great question, a very thoughtful question, Paul, and I know that in a lot of ways your hands are often tied by, what is going on federally, statewide, things of that nature. So obviously, first and foremost, we need an overhaul. We need to really revolutionize the landscape from a national level, but on a local level, because your hands are tied in so many, all of our hands are tied in so many ways. I think what you're already doing is a big step. So like having me on the show talking about these issues is a really important thing, and I think that realizing that you yourself as a public official can't do it all by yourself, right? Like surrounding yourself with people who are in the field and really leaders and visionaries and innovators in the field, and trying to get these services to the front lines, to children, to families, and working together with us is really probably the most powerful thing. And maybe there's a way to garner support from folks who are willing to do pro bono services,
or maybe
like our organization.
One of the initiatives, the Weissman Children Foundation your organization and the Child and Family Institute could do is make recommendations to local governments. For example, we're looking at drive-in movies. Now, that's something that would provide like a safe way for families and children to enjoy the summer because they'd be in their car. There may be other things that you could think of. We were talking about maybe even having like respite programs where there could be 10 kids with adult supervision, and the town would maybe once a week or something have different groups, very small groups. I mean, those are the types of things that I think could possibly help. But maybe
those are fantastic ideas. Yeah,
but maybe
and honestly, we'd be happy to consult in any way.
That would be
with you and your team, and those are fantastic ideas, Paul. Like those are, I think that's progressive thinking. That's exactly how I want to be like approaching this. What are some creative ideas to engage kids and keep folks healthy, mentally healthy, and create as safe as possible space. It's not going to be perfect, but I think bringing in mental health, folks and consultants in that way, it could be really, and partnering and leveraging shared knowledge and things like that could be really, really great. I'd be happy to do that with you, Paul.
That would be great. Or even the camps. You have a lot of local camps. They might even be able to do very small, groupings. So instead of saying, "Oh, there's absolutely nothing," at least there's something to look forward to. But I would love to, work with you, on this. I'm like so inspired by what you're doing. I mean, you're really a tremendous asset and a gift to our community. And I think what you should be really very proud of your efforts. We have to leave now, but my guest has been Dr. Adam Weissman, and his organization, the Weissman Children's Foundation, is working to provide treatment for underserved children, families, and communities throughout the United States. I'm Paul Feiner, Greenberg Town Supervisor, and we'll speak to you soon. Thanks.
Thanks so much, Paul. I really appreciate having me on the show.
Great, thank you.